Hello everyone, welcome to the Junior PCE Case workshop. This workshop is for the case presentation and you can get details about Junior PCE here. The theme of the Junior PCE is hypertension. We hope this workshop will help you to understand and familiarize the case. There are 6 sections in this workshop: definition of hypertension, classification of blood pressure, types of hypertension, risk factors of hypertension, medication guidelines for hypertension, and good lifestyle changes for reducing blood pressure. Hypertension is the theme of the Junior PCE. Most of you may have heard about hypertension, and many of you would know about it, but let's remind it from the definition. Hypertension is a condition in which the blood vessels have persistently raised pressure. For more detail, hypertension is the most common primary disease nowadays, but many patients are oblivious to this. Because hypertension rarely has signs and symptoms, treatment regimens are easily ignored. But we can treat hypertension by lifestyle changes and pharmacotherapy. So as pharmacists, let's know more about hypertension. This table is the major guidelines of hypertension from different countries. We can see that different countries have different standards of hypertension. Hypertension is diagnosed if blood pressure is consistently 140 over 80 mm mercury or higher. This limit is based on a guideline released in 2018 as seen on the presentation table. There are 2 types of high blood pressure. Primary or essential hypertension is the most common type of high blood pressure. For most people who get this kind of blood pressure, it develops over time as you get older. Secondary hypertension is caused by another medical condition or use of certain medicines. There are also some risk factors for high blood pressure: obesity, physical inactivity, too much alcohol, tobacco use, diabetes, genetics, and family history increases the risk of high blood pressure. There are also 3 sections for understanding medication guideline for hypertension. First, medicines for hypertension. Second, side effects of hypertension medicines. Lastly, contraindication of hypertension medicines. Now let's look into the medication guideline. Patients should take medicine regularly and never stop or change a medication without the doctor's permission. If you forget to take a dose, you should take it as soon as you remember. But if the time is close to the next dose, skip the missed dose and go back to the regular dosing schedule, not taking 2 doses to make up for the missed one. Next, let's learn about medicines for hypertension. There are 5 groups of medicines. First, angiotensin-converting enzyme is known as ACE inhibitor. Enalapril, lisinopril, perindopril, ramipril are examples of ACE inhibitors. Second, angiotensin II receptor blockers are known as ARB. Candesartan, irbesartan, losartan, valsartan, and olmesartan are examples of ARB. Third, calcium channel blockers are known as CCB. Amlodipine, felodipine, nifedipine, diltiazem, verapamil are examples of CCBs. Fourth, diuretics. Indapamide and bendoflumethiazide are in this group. Fifth, beta blockers. Atenolol and bisoprolol are examples of beta blockers. You may easily find that there are common regularities for each group, so even though it might be difficult to know all kinds of medicines used for hypertension, you can easily know which medicine is used for hypertension. We can sort side effects and contraindications depending on hypertension medicine. First, ACE inhibitor side effects are dry cough, angioedema, and hyperkalemia, and it is abandoned to pregnancy and hyperkalemia patients. Second, ARB's side effect is hyperkalemia and it is abandoned to pregnancy and hyperkalemia patients. Third, CCB's side effects are headache, flushing, swelling of the ankles, and dizziness, and it is abandoned for heart failure. Fourth, diuretic side effects are dizziness, weakness, hypokalemia, and hyperglycemia, and it is abandoned to gout. Lastly, beta blocker side effects is bradycardia, and so it is abandoned to asthma patients. By living a healthy lifestyle, you can keep your blood pressure in a healthy range. Reduce the amount of salt you eat and have a generally healthy diet. Do not drink too much alcohol, which can raise your blood pressure. Keep yourself at a healthy weight. I hope you gained an insight into junior PCE. Thank you for your attention.